You walk into the ER with chest pain. You're scared. You're breathing heavy. They rush you in, hook you up to machines, maybe keep you overnight, and then you walk out with a bill. A bill for $47,000. No surgery, no ambulance, just tests. I'm Dr. Anthony from The Human Glitch, and today I'm showing you exactly where that number comes from, and why it's not just painful for your body, but for your bank account too. Real bill breakdown. Let's look at a real ER visit bill. This is for a middle-aged patient with chest pain, turned out to be acid reflux. Here's what the hospital charged. EKG, $1,500 basic blood panel, $2,300 chest x-ray, $1,700 facility fee, $12,000 2 hours in observation, $8,400 IV fluids, plus Tylenol, $137. Yeah, $137 for Tylenol. Either it was made from crushed diamonds, or this system has issues. And remember, no procedures, just a few hours of testing and observation for something that turned out to be heartburn. What you're really paying for. So how do these bills get this high? Here's the uncomfortable truth. You're not just paying for your visit. You're covering the costs of patients before you who didn't pay. Hospitals inflate prices to maximize insurance negotiations. They start with a chargemaster, basically a sticker price for everything. Insurance companies negotiate discounts off that number. But if you're uninsured, you get charged the full sticker price. Imagine going to a car dealership, asking for an oil change, and getting charged the price of a Tesla. Welcome to American healthcare. Doctor's point of view. As a resident doctor, I don't see the prices on the screen when I order tests, but I know they're there. Every test, every pill, every extra hour adds up to a line on your bill. Same ER visit. Uninsured patient, $25,000. With insurance, $4,200. Same room, same doctor, same care, but a $20,000 difference, just based on whether or not you have insurance. And here's something worse. Hospitals often get paid more when a patient doesn't pay. It's called cost shifting. They claim the loss on taxes or pass it on to the next patient, so no one really wins, except the billing department. Why this system persists. So why does this system still exist? Because every player in the system benefits, except the patient. Hospitals charge high. Insurance looks like the hero for discounting. Insurance raises premiums to cover costs. Patients get crushed by surprise bills or go into debt. There are countries that cover everyone and pay less overall. But here it's a profit-driven system. So patients pay with money. And sometimes with their lives. Okay, now the important part. What can you do? Always ask for an itemized bill. It forces transparency. Dispute overcharges. Even Tylenol can be negotiated. Know your rights. Hospitals must provide emergency care, insurance or not. Use financial aid. Most hospitals have hardship programs. Record everything. Take notes during your visit. And if something looks shady, you're allowed to push back. The system banks on people not asking questions. If you're in the US, you have to fight not just for your health, but for fairness. Stay sharp, ask questions, and don't be afraid to advocate for yourself. For more honest breakdowns of health bills, sketchy trends, and what actually works, hit that subscribe button. I'm Dr. Anthony. See you next time.